Hello, we're Group 5, and today we're going to be presenting our intervention Spa Cola, or student and staff-run physical activity club to combat childhood obesity in Latinx adolescents. Childhood obesity is characterized by children with BMI greater than or equal to the 95th percentile, according to CDC growth charts. This disease has a high burden in the US, where 1 out of 5 children were diagnosed between 2017 and 2020. The highest rates were in Hispanic/Latinx children, who made up a quarter of cases, followed by non-Hispanic Black, non-Hispanic White, non-Hispanic Asian children, who had the lowest rates. Higher rates have also been found in lower income children. Some major health consequences of childhood obesity are type 2 diabetes, hypertension, heart disease, high cholesterol, and other chronic diseases, which are all major risk factors or major diseases that led to death in the United States. In San Diego County, which has a higher proportion of Hispanic individuals compared to the rest of the US, a little over 2 out of 5 Hispanic children were overweight or obese in 2018, which is 2 times more than non-Hispanic white children. Chula Vista specifically has around 60% Hispanic population.
Moderate to rigorous physical activity is known to prevent obesity. However, only 1 out of 4 Hispanic children meet guidelines, and those 15 to 16 years old are most at risk for this behavior in this group. Time and length of safety are major barriers to physical activity, and we make sure increase safety in our intervention. One previous intervention was done in middle school in Midwestern U.S. target girls in underserved communities. This includes an exercise club and meeting with the nurse and intervention service to discuss motivation.
Another intervention was a web-based intervention that included logs and educational materials for students to fill out, and this led to a decrease in BMI. Another intervention was a family intervention that included lectures for parents on obesity, physical activity, and nutrition, leading to an overall decrease of obesity in children. Our intervention was specifically focused on moderate to vigorous physical activity in freshmen in high school, with an emphasis on Latinx students. Our intervention will include a student-run club every day after school. Staff will also be running these activities to help educate and motivate children. We will also be offering a web-based self-monitoring app that includes educational materials and logs for students to fill out. This club will also host parent physical activity fairs that will include educational materials in Spanish. And for obese children, we will host extra meetings with the family for further guidance.
Our study design is a community, parallel, and randomized intervention. Our hypothesis is that participants in the MVPA intervention arm will have greater increases in levels of MVPA as measured by PDPAR and the sense-wear armband compared to participants in the control arm. The schools involved are Chula Vista High School and Castle Park. Chula Vista has 85.1 Latinx population, and Castle Park is an 87.6% Latinx population. Both schools will receive baseline measurements. One school will receive the MVPA club and parent fair intervention, while the other will be the control group. The baseline measurements will be PDPAR, which is a daily recall survey sent via email that each student will get time in the morning to do. The sense-wear armband is a daily armband that tracks activity for 5 days. And the BMI and waist circumference will be taken by nurses set up in the gym for 1 week. And here is the baseline measurement schedule.
Our intervention will first be targeting the individual level of the social ecological model through the web-based self-monitoring, education, and participation in the club. We'll be catching students in the pre-contemplation stage and hopefully pushing them through to maintenance of their physical activity levels, as based on the trans-theoretical model. We'll also be targeting self-efficacy, self-control, expectancies, and behavior control, as based on the social cognitive theory. At the interpersonal level, students and staff will be leading to reinforcement and vicarious learning through role modeling. And finally, since our club will be after school, we'll be targeting the built environment and improving safety, hopefully removing barriers. Our process evaluation will include app data, attendance, and meeting summaries for both the fair and the club to make sure that our intervention is being used correctly and used by students and parents. We'll also be measuring awareness of both the students and the parents. Since we're targeting physical activity in our intervention, we'll be using the PDPAR survey, which is a subjective and validated measure, and the Sense Arm Monitor, which is an objective and validated measure to measure physical activity levels and making sure they're moderate to vigorous. Since we're hoping physical activity will impact obesity rates, we'll be using BMI and waist circumference from nurse measurements in order to measure obesity rates. Thank you for listening.